Welcome to our lab. Over the next few minutes, you're going to find out how we metabolize glucose, what paths glucose takes through our body when we eat, and the changes that happen in type 1 and type 2 diabetes. But don't worry, you won't be alone on this journey. You'll have some travel companions. Let us introduce you to them. Glucose, fructose, and galactose, which are sugars and supply energy to our organism. Insulin is the hormone produced by beta cells in the pancreas, with the mission of joining up with glucose so it can enter cells and give them energy. There are three kinds of fat: bad cholesterol, good cholesterol, and triglycerides. Your other travel companions are proteins and antibodies. Get ready, because the miniaturization process will start in 3, 2, 1. Good! The process was a complete success. We have reduced you to 1/1000th of your normal size. Now you're about to have the adventure of your life. Let's go! It all starts with chewing. Hear the incredible power of your jaws. With the help of the muscles in your cheeks, your tongue, and saliva are going to transform food into what we call bolus. On both sides, you can see how food is processed, which is the first step in the digestive process. Let's move on to the next one. Put on your seatbelts. It's full speed down the esophagus. On either side, you can see how the muscles of the esophagus wall are working to help food make it down to the stomach. The stomach stores and processes the food we eat and mixes it with gastric juices. Look to your left. Sugars are starting to break down into glucose, galactose, and fructose. And if you look to the right, you can see how fats are slowly breaking down into triglycerides, HDL or good cholesterol, and LDL or bad cholesterol. Now we're in the small intestine. It's a very important stage of our adventure because 90% of digestion happens here. You see those little hairs around you? They're called villi, and they help minerals and nutrients like sugar, fat, and protein go into the blood. Look how they're going straight into the blood vessels. Want to go with them? We're now inside one of the thousands of blood vessels we have. They're responsible for carrying blood to different organs in the body. Around you, you can see the different components of blood. White blood cells, which defend our system from infections, and red blood cells, which carry oxygen to the cells. There's also protein, fat, sugar, and vitamins. Wow, here's a new organ. We just entered the pancreas. The pancreas has two main jobs. First, it produces enzymes that go straight to the small intestine to help in the digestion of fat, sugar, and protein. Then take a closer look at the beta cells. See how they secrete insulin? This is an essential hormone for our body. It joins up with glucose to form these compounds. Now let's get a closer view of how it works. Because of insulin, the glucose can go inside muscles, one of the most important systems in the human body, and we can move around freely. On the wall of muscle cells, you'll encounter receptors which, joined by compounds of glucose-insulin, enable cells to absorb glucose. Look at the effect of glucose on muscle fibers. Look how they contract and relax. That's how a healthy body works. Now, as you can see, our body does not use all the glucose. The glucose that is not needed is stored in the liver, the kidneys, and in the muscle itself in the form of glycogen. So when we need to have higher levels of glucose, the pancreas's alpha cells release the glucagon hormone, which converts glycogen back into glucose. Let's continue our journey inside a blood vessel to see how fat works. Let's see what happens to fat, another of our travel companions. Look, come closer. In a healthy body like this one, good cholesterol eliminates particles of bad cholesterol and triglycerides stuck to the walls. If you look carefully, you'll see how this keeps the vessel walls clean, so that every component of our blood can flow normally. Nothing stays still in our blood. Everything is in movement, and everything needs to be able to flow unimpeded. We're now entering one of the kidneys, the organs with the job of filtering blood and disposing of waste through urine. That's a really important function for our system. As you can see, we reach the kidney through a blood vessel. Outside the vessel, we encounter a Bowman's capsule, which is transparent gray and smooth. On the right, you can see how protein, sugar, and other substances filter through the membrane into the urine, and then come back through the membrane towards the blood vessel. We're now arriving at one of the most important stops on our journey. Can you see it back there? There, beating with all its might? The heart, the king of our body. If you look around, you'll see that everything is clear and blood can flow to the rhythm of the heartbeat. It's a healthy and strong heart that sends life to the rest of the organs in the body. Let's see where this takes us. Wow! It looks like we're arriving on another planet. We're surrounded by elements we haven't seen before. We're in the brain. The brain receives information from the rest of the body, interprets it, and directs our response. It bears principal responsibility for both our thinking and our movement. Let's see how it works. As you can see on your right, glucose penetrates nerve cells without needing insulin. Look how the nerve cells, also called neurons, react when the glucose comes in. The nerve signal is transmitted from neuron to neuron. Now we're in the eye. I'll bet you never imagined you could see the world from another body. That's an amazing feeling, isn't it? You see how clearly, how well you can see things when everything is working just right? It's like being on a big movie screen, isn't it? Enjoy the view. The second stage of our journey begins. This time, you're going to explore the interior of a human body with diabetes, and you'll see how it affects the normal functioning of our system. Our journey begins in the pancreas after the process of digestion. Looks like things have changed since the last time we were here. What a mess! This is a body with type 1 diabetes, in which antibodies are preventing the pancreas's beta cells from working as they should, and they're unable to release all the insulin we need. If you look carefully, you'll see that what little insulin is produced is correctly binding to the glucose, but it's not enough. The other glucose molecules are left free to flood the bloodstream. This increase in glucose can lead to multiple complications in our system. We have to bring it under control. Because cells are not absorbing enough glucose, our muscles are not getting the energy they need. This makes our system think that there isn't enough glucose, so the pancreas's alpha cells secrete glucagon, which converts glycogen from the liver and muscle into glucose. The glucose molecules released go through the cell walls and join those that were already in the blood. Now you're going to see what happens with type 2 diabetes. Look at the beta cells on the wall to your left. Although they produce even more insulin at first, after that they get tired. Also, there is a resistance to the insulin. This means that the insulin is not binding properly with the receptor and the glucose can't enter the cell. Because it can't be absorbed by the cells, the pancreas's alpha cells think this is due to a lack of glucose, so they start to secrete glucagon, which raises the level of glucose in the blood. That's why you're now surrounded by glucose molecules. Our system needs insulin so that glucose in the blood can enter our body's cells, and the body can use it as a source of energy. If resistance to insulin increases, glucose levels build up in the blood, which can end up damaging the blood vessels that supply blood to our vital organs. The scene has changed. Now you're inside a blood vessel. Here you can see how fat operates in a body that has diabetes. What a mess! Bad cholesterol, or LDL, has taken over, invading everything. Bad cholesterol makes itself at home and hinders the action of insulin, preventing cells from properly absorbing glucose. We're back in the kidney, but it's really hard to recognize. Diabetes causes serious damage to the kidney. Look closer, and you can see that the capsule surrounding the vessel is full of holes, thus losing glucose, proteins, and other molecules. Unlike in the healthy body, most of the important ones won't come back, and they'll be lost in urine. We're going to try to leave through the exit vessel. It won't be easy, because this vessel is smaller and it's blocked up by a buildup of fat. Now that's a disaster. Sugar is wrecking the aorta wall. Look to your right. Abnormal dilations are appearing, called aneurysms, that weaken the blood vessel wall. But that's not the only thing that's been affected. Look, the insufficient blood flow causes another series of complications in the body, such as muscle atrophy. One of its effects is deformation of the feet. This, along with lower sensitivity and moisture of the skin, favors the formation of ulcers on the soles of your feet. Diabetes can cause many types of damage in the human body. Let's see more. We're back at the heart, the king of the body. But as you can see, it's only a shadow of what it once was. Fat builds up on the walls and blocks the coronary arteries, keeping blood from flowing freely. The blood flow from the heart decreases, which is very dangerous to the body. This can cause a heart attack. On your right, you can see that there is a part of the heart that's stopped beating. The heart is a muscle, and part of this muscle is damaged because the coronary arteries are blocked, keeping blood from reaching it. Heart failure can also occur when the heart is unable to pump all the blood our body needs. Let's see how diabetes continues to affect our system. We're back in the brain, but did someone turn out the light? Glucose levels in the blood are very high, and there is also a lot of fat stuck to the blood vessel walls. This may result in an obstruction of the vessel and a stroke. This is similar to what happened in the heart. Things aren't looking good. What are we going to run into next? This is the last stop on our journey. The eye is one of the organs in the human body that is most seriously affected by diabetes. It causes significant damage to the small vessels in the retina and can result in severe vision loss. These little pockets coming out of the vessels you see before you are called microaneurysms, and they're the first sign that diabetes is affecting the retina. We can see inside the eye a buildup of VEGF, a molecule that causes damage to the retina when its levels are high. We also find cells and other components of the inflammation. VEGF and inflammatory cells cause a buildup of liquid in the center of the retina, in the area called the macula, the zone that enables us to see details of things, the area of most vision. See how it's filling up with liquid and swelling up? VEGF molecules also stimulate the growth of abnormal vessels that become surrounded by a fibrous and whitish mesh, and they can pull on the retina and even detach it and cause hemorrhages. If this problem isn't properly treated, it can cause substantial vision loss. The journey is over, and now is the time to return to normal size. Let's start. Welcome back to the miniaturization room. You have now seen what diabetes can do to your body. Even though it is a chronic disease, if you can control it, you can enjoy good quality of life. Now, to conclude, here are a few tips. Diabetes is a controllable chronic disease that allows for good quality of life. This is what helps to control it. A healthy Mediterranean diet, avoiding carbohydrates that quickly increase glucose levels. A diet that is low in saturated fats. A diet that avoids an excess of proteins. Exercise is a fundamental way of preventing type 2 diabetes and of treating type 1 and 2 diabetes. Exercise for 150 minutes a week is recommended for adults on alternating days, and 60 minutes a day in the pediatric age group. It's essential to properly monitor levels of blood glucose, or sugar in the blood pressure, and fats like cholesterol and triglycerides. Diabetic education is a vital element in managing diabetes because it helps a patient learn how to control him or herself. To prevent type 2 diabetes, a healthy diet and regular exercise is absolutely crucial in maintaining an appropriate weight. With these tips, our experience has come to an end. We hope you give consideration to everything you have learned about diabetes and that it helps you to enjoy a happy and healthy life. See you soon!